I'm live again. We lost Liza, but hopefully she'll be back. I've been in a technology black hole for a couple of weeks, so apparently I'm still in it. And now nobody's watching. Oh, a couple of you are here. Liza, there you are. I'm going to bring you back on.
All right.
There you are again. I don't know. All right.
Doesn't
Hi,
help that
Ellie.
I'm a
You're
little bit of
back.
a neophyte with this stuff.
This is not us. This is technology not
Okay.
being kind to us.
We'll blame technology.
So
Okay.
you pick up where you left off.
I'm not exactly sure what people heard, but I was basically saying with regard to this person's 4-year-old, I don't think you have to like panic. Panic doesn't help anybody.
Right.
But you know, I think it's a conversation to have with your pediatrician. There's no reason why you can't go in a little bit earlier if you're feeling anxious about it and you want to get him or her immunized early. Children need 2 MMR vaccines after 1 year of age. So you can have it at 1 year, at 12 months and 13 months. You can have it at 12 months and 4 years. You can have it at 12, you know, you just need 2 after you've turned 1 year of age. So the dose that people, children might get between 6 and 11 months does not count towards their immunization series. It is an extra vaccine.
Interesting. All right. And so talk to me about newborns. You said they have passive immunity from their mom.
Correct. And that's the most important thing to remember. So if mom is immune to the measles, she passes that on to her baby. So that we know there was a question about a 3-week-old. That 3-week-old is actually more protected than a 6-month-old or a 7-month-old. As babies get older, they start to lose the maternal immunity as their own immune system starts to build up. And that's the reason that the dose between 6 and 11 months does not count towards the series. You still have maternal antibodies the baby still has maternal antibodies in the system, so their own immune system is not mounting a strong enough response to their vaccine. And that's why you need to also receive it at 1 year of age.
Okay.
Not you, the baby.
Yes. Someone said my toddler has had his vaccinations, but should we be concerned if I'm pregnant with baby number 2? I'm vaccinated, paranoid about babies. You kind of just answered that question. That's
yes. I think most people are very concerned about infants, and that's who, for a mom who's immune,
they're good.
Generally who we're not concerned about.
Okay. So should mom get a booster? Is there any value in that?
So mom cannot get a booster while she is pregnant. It is a live virus vaccine, and it cannot be given when women are pregnant. But if mom is not immune or does not measure the titers in the blood that is drawn are not detectable, can get that after the baby is born, and it is fine while breastfeeding, but not while pregnant.
Okay. So you read the comments on MOMally parenting, so that's why there's a lot of comments here about like, oh, my 6-week-old and people with little babies. So that should feel comforting to them. Somebody's daughter has an egg allergy. Her pediatrician said to wait on the MMR.
So there is no contraindication to giving the MMR vaccine with an egg allergy. It is grown in chick embryo, but that is not something that we are typically concerned about with regard to having a reaction. So I'm not sure why that recommendation was made.
Okay. All right. Should I be concerned? Oh, okay. I'm going to just read the whole thing. I'm not sure if this is something the doctor can answer, but I'd like to know if there are unvaccinated children in my daughter's daycare facility. I don't need to know who they are, just if there are unvaccinated children enrolled. Is this information I legally have the right to know? I'm in Westchester. Thanks.
So
that's an interesting question.
It is an interesting question, and actually something that I had recently asked about, because technically daycares can accept unvaccinated children. And there are a lot of children that cannot be vaccinated for medical reasons, and they should not be excluded from daycare. this goes along with just the sort of idea of living within a society where when someone is immune compromised or is unable to receive a vaccine, if others around them receive the vaccine, then they are helping to protect a child who cannot receive that protection. But my understanding from what I got, which was very vague, is that you can ask if there is a child who is not immunized, but beyond, and they can say yes or no, but I think it stops there. So it could be that they don't get the flu shot, or that they don't get, some other standard, because I don't know about in Westchester, but in New York City, flu shots are required for early elementary education facilities. And so they also can't tell you why that child is not vaccinated. So again, it may not be somebody who's choosing not to vaccinate for reasons other than it's medically contraindicated. So it's a tough question. I think now with the outbreak, people may be more sensitive to, most specifically the measles vaccine. And if there are, I generally tell my patients who have friends and family who don't vaccinate their children that they should not have their unvaccinated child with those children. I think that...
So piggybacking right on that, someone said, what kind of things should we keep in mind as we go about our normal day-to-day life? I have an almost 1-year-old, this mom said, and she has gotten each of her scheduled vaccinations. We go to play groups, library groups, mom and baby groups. We're out in the world at playgrounds. And do people need in Williamsburg or in places where there is an outbreak, do they need to be altering their daily activities? And in other places, do they need to be doing that?
I think that people have to be aware. I think that people have to be cautious, but I don't think that you have to shut down living and stay in your apartment. I mean, I think that in certain neighborhoods where there's a high incidence of measles, I wouldn't necessarily drop my unvaccinated child off at a daycare or something of that nature where you can't really understand what's going on. But the bottom line is that children especially with the measles, can be contagious 4 days prior to developing a rash. And so most of the time, parents think of measles as just the rash, but it does have symptoms prior, fever, cough, runny nose, which all of our kids have, but
All
also,
winter.
yeah, exactly. And also conjunctivitis, like red eyes in conjunction with that, and fever. But they are contagious prior. So I think if there are children wherever you are that are sick, even though they may have a cold and it seems silly, you may want to avoid spending time with those folks and be a little bit more cautious now. I don't know if that was super helpful.
Yeah, what does cautious mean? Like that.
Right.
It's a hard answer.
It is, but we make decisions as parents. We make decisions every single day that may be good ones and may be not such great ones. And it is a challenge. And I think that going to a playground is an important part of your child's development, and it's getting warmer, and I think that's fine. I don't know that if I had an unvaccinated child, that they were in an age where I was concerned between 6 and 11 months, if they weren't vaccinated, that I would go to a playground in one of those 4 zip codes. I would feel more concerned and more cautious.
Someone just commented on the live video here and said her pediatrician advised against immunizing the baby at 6 months unless there's an active outbreak in an area where my child would have exposure. They live in Westchester, where there are measles cases nearby, but she doesn't think that it's close enough to merit early vaccination. Her question is why? She's so anxious about the outbreak. She doesn't want to go against the current CDC recommendations, but she's a stress case about it, her words.
So is it that the pediatrician doesn't want to go against the CDC recommendations, or is it that the mom
pediatrician thinks it's not? No, the pediatrician thinks it's not necessary, from what I understand. The pediatrician said, no, we don't have to do it early. And the mom's like, yeah, but I want to. Even though I don't really want to go against the recommendation, why are we waiting is the question, I think.
Right. And this is
Jessica,
where
correct me if I'm wrong.
This is where, I'm all pediatricians practice differently and have different attitudes about it. And maybe this pediatrician doesn't want to create more anxiety around it by doing something that is not necessarily recommended. But I think there already is a tremendous amount of anxiety. And, you know, I feel like one of my jobs as a pediatrician is to try to lessen that anxiety, because there is so much of it, that I feel that if it's something that's going to help you to sleep at night and make you feel better, I personally wouldn't. I would tell you the recommendations, and I would say, you know, there's no international travel. There's no, you know, whatever. You don't live in one of the zip codes. We don't have a lot of cases, but we're hearing about cases popping up in areas constantly. You know, we just heard about LA. We're, you know, I mean, there are places where we're seeing the measles. So I think if you're so anxious about it, my feeling is there's no downside to it, and living in that constant state of anxiety is very, very unpleasant.
Right. And unhealthy and not good for mom or baby.
Exactly. Right. Exactly.
Okay. There are more questions. I just have to.
I mean, Andrea, I should just mention quickly that, you know, we don't know. We don't know where it's going to go. We don't know how it's going to change. The hope is that it will die down as people are more aware, and you know, both as practitioners identifying it, as well as families, you know, being vaccinated on time. But we don't know. And so I think that's that anxiety of, like, it's very easy for me to say this is what the CDC recommends, but I'm not in your living room worrying about every day that you walk outside with your 8-month-old that you're going to be exposed. So I think we have to, as pediatricians, we have to be very sensitive to that.
So if someone asked, someone said, my child is 2 and up to date on all her vaccines. Is there a possibility of her contracting measles if she were exposed to the virus? Like, can a fully vaccinated, healthy child still contract it?
Yes, because there is no vaccine that is 100% effective. With 1 dose at 2 years old, your child has probably had 1 dose of the vaccine, which means that they are in fact up to date, but that confers 93% immunity. So there is a 7% chance. If after 2 doses, it's a 97% immunity. So there's a 3% chance. So there is always a chance, but it is much lessened. The other thing, getting the disease is much less. One thing though to mention is that even though babies lose maternal immunity and are vulnerable in the later part of their first year of life, and after 1 dose, it's 93%, and after 2 doses, 97%, there still is some immunity. So your symptoms from, if you do get the measles, might be much less severe than someone who is what we would say naive. So somebody who is over a year of age, has completely lost maternal immunity, and is completely unvaccinated. So there is that difference.
Gotcha. Same goes for adults who are up to date with immunities. Same thing, and it was, chances are that the symptoms would be less.
They could be, yes. If they'd received 2, they can have waning immunity. But the likelihood is that unless they were immune compromised for a reason, you know, unrelated to just being a healthy adult, that is likely as well.
Why do they wait until a year for the first dose?
Because if you have some maternal immunity, still, when you get that first shot, your own immune system doesn't react as robustly because it has some partial immunity. So you're not going to be as well protected from that vaccine. You need to be kind of a clean.
Right. They need the vulnerable period.
Or even just a period when there's no maternal interference. So if they got a vaccine between 6 and 11 months, they would have some of their own immune system in conjunction with mom, but it wouldn't be a powerful enough response. After a year, there's no maternal immunity lingering around. So it's all their own immune system that is responding and reacting to the vaccine.
Cool. That's helpful. Sorry, I've lost track of my window with the questions on it. Someone asked, is there a risk from the virus being, quote, live? Someone posted in MOMally recently their baby was immunized at 6 months and her titers checked at 9 months and wasn't immune to measles. Does that make sense to you?
It does make sense to me, but I'm not totally sure why they were checked. And
yeah,
that's like a very unique situation. So I'm not exactly sure. We don't routinely check immunity, immunity
yeah.
titers after the vaccine. So I'm not exactly sure what the purpose of that was, if there was something else that was going on.
Yeah, I don't know. Does breastfeeding help with immunity for an infant under 1 year?
So, yes, like with anything, there is transfer of maternal immunity provided mom is immune. So it can be helpful. I'm hesitant a little bit with that one, only because it's not a reason. It's not like you're totally vulnerable if you don't breastfeed, you weren't breastfed, and you're, totally fine if you are, like,
right.
There is some subtle benefit. Yes.
Okay. Is it likely that people can lose immunity or not likely as an adult?
You can lose immunity. Immunity can wane. So there are many people who are called non-responders to the vaccine, and they never mount an immune response. But there's a lot of debate about whether or not they're not mounting an immune response, or they're not mounting a lab test detectable immune response. So there may be some element of immunity that we still hold, but it's just not measurable. Does that make sense?
Yeah. So should people go and get checked and see if they're still immune and get
actually, my suggestion would be for anybody who is planning to become pregnant in the next several months, I do think it is a good idea to have immunity titers checked, because if you are not immune, you can get a vaccine prior to pregnancy, which you cannot get during pregnancy, which will then, you will have that passive transfer of immunity to the baby.
If this is a very specific question, if a fully vaccinated mother is on an immunosuppressant medication during pregnancy and birth, could that affect the transmission of maternal antibodies to the infant?
If mom is on an immune suppressant medication during pregnancy, I would presume yes, but I don't. I would have to look further into sort of more specifics of what medication
and the whole situation.
Yeah, exactly, and the story. Yeah.
Okay. Someone said the insert in the MMR says safety is not established to give the MMR to a 6-month-old. How do I know it is safe?
One thing you have to be mindful of is that you could read an insert of anything,
and like the ads,
and it will tell you that it's not safe. I mean, like, this is why, exactly like Andrea mentions, there's an ad for like a moisturizing lotion that could cause death, and it's like, oh my God, I'm not going to use that lotion.
Like Stephen Colbert. Did you ever watch Colbert with back with the Colbert Show, when he had his pharmaceutical company and he would make up these crazy side effects? I have to find one and I'll post it on MOMally. They're amazing. They're so funny. He's like, it could cause, and it anyway.
Right. It's like, why would anybody take that medication? It's horrible.
Yeah.
So how do you know that it's safe is the question. The reason that the vaccine says this in the insert is that it's not studied as thoroughly in infants 6 months and over. So it's not a matter of then it means it's not safe. We don't know. How do you know? I guess the way we know anything. It's like we presume. Children have been getting immunizations between 6 and 11 months. There are no significant side effects. It's a very safe vaccination. And so I can't really answer that with scientific data because there is no scientific data. They don't do tests in children at that point. They may now, but they don't do the studies.
And don't we know that it's safe because it's given and babies are then immunized and not contracting diseases?
Well, between 6 and 11 months was the question.
Oh,
how do we know it's safe between 6 and 11 months?
Where they're not, yeah.
Yeah.
I'm afraid I'm missing questions because there were questions in 2 different groups. So I'm just checking. If anyone here is watching and has a question that was not answered, someone just asked, I think this was answered before, but just to reiterate, someone just said, why do children have to wait until 4? Would there be harm in their 2-year-old getting the vaccine?
No. It's actually a very good question. Why do they wait till they're 4? It's very arbitrary. There's no, it just needs to be, the second dose just needs to be 28 days after the first dose, and then the child is completely immunized. This is purely my thought process. This has nothing to do with anything that I have read. I'm just trying to figure out why we wait until 4. And I think some of it may be that is when children typically go to school. And so we help to boost up, even though they often go to school earlier or daycares, but we boost up their immunity at that point once they're going to be in sort of a large group of children setting. But I think it is somewhat arbitrary. It just needs to be 28 days after the first dose that was received.
And someone just asked, this is a question, I think it's someone who probably tuned in later, and it's sort of been covered already, but Lisa Turner just asked, what are your thoughts on using the subway with an unvaccinated infant? I feel like I could answer that one now. I would say the infant has passive immunity from her mom at 2 or 3 months old. Don't let them lick the poles.
I wouldn't do, and on the subway, they're more likely to get a cold or, it's a very convenient way to travel, but you generally want to hold them either in some type of carrier that keeps them up against your chest and away from, nosy strangers, or in some type of stroller where it's covered. Now, keep in mind that since we're talking about the measles is an airborne virus. And if it is very, very, very contagious. And so if you are in a space where someone has the measles, that space needs to be completely, that space is considered sort of contaminated, for lack of a better word, for 2 hours after that person has left. So if you're in a grocery store and there's someone with active measles, that grocery store, for all intents and purposes, has to close down for 2 hours before it can reopen. So it is very, very contagious.
So in the interest of helping everyone lower their anxiety, because I feel like that's very anxiety inducing. Like, I wasn't anxious logging on for this, but I'm like, oh my God. It general, like, hand washing and common sense come into play here, right? Like, if you are pushing a cart in a grocery store, maybe wash your hands right after. Use some hand sanitizer.
Yes, because it can live on fomites. It can live on surfaces. So to that, yes.
Same with subway poles, and I mean, but that's the same in preventing any illness. Like, if we are conscious of hand washing, that goes a really long way.
Yes.
Yeah. Liza and I teach an infant care class together, and we do a whole thing on keeping old ladies away from your baby. Nosy old ladies who just love tiny babies, and they'll reach right in the stroller. Actually, just a couple weeks ago, someone grabbed Daniel's hand at the supermarket. A very sweet little old lady came up and took his hands and said, "God bless you," with both of her hands on his hand. And I was like, lady, come on. But
that little old lady probably had the measles, so she's immune.
Yeah. True. I don't know if she had a cold. I mean, God only knows.
No, I know. People, I mean, they love babies. People love babies, and they do it out of love, but it's very annoying.
Yes. So Sarah just asked, should parents get a booster? Which we kind of addressed. If you're thinking of getting pregnant, you should get titer and see if you are immune. Is that correct? And
Yes,
if you,
that's what I
if
would
you have
recommend.
older children and you're not having any more, is there value in checking to see if you're immune?
I it's not as far as I'm concerned, it's a little bit of neither here nor there. I feel like there's a lot on Facebook now, like if you were born before 1990, you should get, you know, a booster dose or whatever it is. um I mean, if it means anything, I'm not.
Mm-hmm.
You know, I mean, like I have not. I did get titers checked before, you know, 15 years ago when I went into practice, probably
Yeah,
20 years
and
ago
also
now, you know.
probably before medical school. Like I had to do it before graduate school.
Right. I mean, there are times
So
that we've, you know, and you
yeah,
can have waning immunity, but I don't think that there should be a mad rush necessarily to do that
cool.
personally.
I feel like we've taken enough of your time, and it's 25 minutes to Game of Thrones. Do you guys watch Game of Thrones?
I do not.
You do not?
No.
Oh, okay. Well,
But I
I have to
clearly
go.
you have to get ready.
I have to go prepare. I have things to do. And I think,
Absolutely.
I feel like is there anything that you feel like you wanted to say that we didn't get to?
Um, No, I think we covered a lot of it. I just think it's important for people, like, panic gets us nowhere. I think if you're concerned about something and it doesn't sit right, you speak with your pediatrician about it.
Mm.
But I don't think that we have to shut down and no longer live our lives. I mean, it is in New York City, at least, it is somewhat isolated to specific neighborhoods, which is not ideal for those neighborhoods, but is helpful in some
Yeah.
ways.
Okay.
All right.
Thank you so much.
Thanks, Andrea.
All right.
All
You
right.
guys
Take care.
enjoy Game of Thrones and have a good
Bye.
night. Bye.